This is a presentation of the community analysis of the city of Gulfport by Sable, Kolodziej, and Alex Schultz. The objectives of this presentation are to provide a historical overview and a community analysis of structure, population, environment, health-related resources, and government, and public policies of the city of Gulfport. A prioritized selection of community problems will also be provided, as well as the global perspective of the issue of poverty. In 1880, a fishing captain and his wife became the first settlers to occupy the land known today as Gulfport. This waterfront fishing community has kept its reputation throughout all these years as a great tourist destination. In the 1890s, Gulfport was only accessible by watercraft. The town has its own ship named Mary Diston, and visitors came from all over to enjoy the only hotel by the water, known as the Waldorf. Soon the hype of Gulfport died down and its economy started to dwindle due to the railroad surpassing the city. In the 1900s, Gulfport gained a trolley service from St. Petersburg, which helped with easier access to the city. William Chase began to turn this community into a retirement paradise for Civil War veterans in the 1900s, and the name changed to Veteran City. Chase made major developments such as building a casino with a dance hall and a wooden pier used for fishing. The casino still stands today and is one of the major landmarks of the city. The dream of the veteran paradise never made it, and the name Gulfport took its place on October 12, 1910. Through the years, Gulfport has made its mark as one of the most charming cities in the Bay Area. Its rich culture of art, ideal waterfront views, and diverse population give it uniqueness you can't find anywhere else. Today, Gulfport has a land area of 2.83 square miles. Gulfport's population at the last census was 12,209, and its density is 4,361 per square mile. Don't let Gulfport's small town atmosphere fool you. Currently, the city continues to reestablish its vitality to residential and commercial areas by keeping up with the national trends. The city of Gulfport has numerous places of recreation to meet the needs of its diverse population. One of the most well-known establishments in Pinellas County is the Gulfport Casino. The Gulfport Casino, first built in 1906, isn't a gambling casino. It's a place for social gatherings and dancing. Unfortunately, it was destroyed in 1921 by a hurricane and wasn't rebuilt until 1924. Due to the casino not being built strong enough and how often it was used, the one that still stands today was built for the last time in 1934. To this day, Gulfport Casino is a historical landmark that is used for many social gatherings and celebrations. Gulfport is also home to many nature preserves and a recreation center as well. There are many great schools ranging from elementary to collegiate in Gulfport. One of the most popular schools is Stetson University College of Law. The school was founded in 1900 and moved to Gulfport in 1954. Having a collegiate presence in this community has assisted in Gulfport's evolving community needs. Another thing that sets Gulfport apart from surrounding cities is the multi-purpose senior center. This nonprofit organization's purpose is to promote individuality and independence to the elderly population in Gulfport. They hold multiple classes including art, Spanish lessons, and fitness. By having multiple social gatherings monthly, the class attendants are able to mingle with one another and socialize. There are many programs and resources available for seniors throughout Gulfport, but little resources for the young to middle-aged population. During the community assessment, it was difficult to find resources related to family services and pregnant/parenting teams. In the last 10 years, Gulfport has had population decrease of 2.9%. It is now home to 12,209 residents, with the majority of them being between ages of 20 to 65 years old. The decline in population could be from a range of possibilities, including the price of living increasing. Due to the amount of residents receiving public assistance, there is obvious evidence that people can't afford living costs. There is no specific information regarding the city of Gulfport and its health concerns, so the following information is based on Pinellas County. The leading causes of death of Pinellas County are cancer, heart disease, chronic lower respiratory disease, unintentional injury, and cerebrovascular disease. Pinellas County and Florida have the same leading causes of death. This information is probably similar to Gulfport's information. Cancer could be due to the fact that many people are exposed to the sun while living in Florida, but there's no evidence of this. Heart disease may be linked to obesity, smoking, alcohol, and lack of exercise. The city of Gulfport may need to further its education on exercise and healthy living. Gulfport has many health-related resources available to its residents. There are skilled nursing facilities, convenient clinics, and home health agencies. The nearest hospital is located in St. Petersburg, along with the nearest health department. These facilities are available to all residents to provide affordable and efficient care. 3 of the Healthy People 2020 objectives that are applicable to the city of Gulfport are physical activity, obesity in children, and family planning.
There are parks, centers, and trails within the Gulfport community. There are 9 total parks located within the Gulfport community. Parks and recreation are huge parts of the city of Gulfport, and they each have multiple activities to engage in. One of the major parks within Gulfport is Clymer Park. This park is 7.5 acres and includes a sculpture garden, 2 small boardwalks, brick walkways, large flower beds, and a pavilion. In addition to parks, Gulfport includes multiple activity centers that include a recreation center, senior center, and the 49th Street Neighborhood Center. The recreation center offers activities, classes, and programs for all ages. The Pinellas Trail also runs through Gulfport, which its residents can walk, run, or bike toward either downtown St. Pete or head north towards Tarpon Springs. The police department, fire department, and public works are all a huge part of the general funds of Gulfport. The city of Gulfport puts the most amount of money towards the police department, fire department, and public works. 43% of the general funds go to the police and fire department, and 19% goes towards public works. The Gulfport Police Department has Marine Patrol and traffic safety squads along with their uniformed patrol officers. Gulfport Fire Rescue responds to nearly 3,000 emergency incidents annually and has 4 firefighters per 24-hour shifts, including 1 lieutenant and 1 paramedic. The fire department provides advanced life support, emergency medical services, fire suppression, fire inspections, public education for fire safety, hurricane preparedness, pool safety, and CPR training. Gulfport Public Works is responsible for curbside trash pickup, maintaining approximately 68 miles of paved and 32 miles of unpaved streets, and providing regular maintenance of roads, curbs, sidewalks, alleys, and signage. Additionally, Gulfport Public Works recycled 1,150 tons of material in 2012. Water supply and quality has been a concern for Gulfport as well as statewide. Some of the programs that were put in place was the use of reclaimed water for lawn and outdoor use. There are specific days that the City of Gulfport residents can water the lawn. Addresses ending in even numbers can water on Thursdays and Sundays, while addresses ending in odd numbers can water on Wednesdays and Saturdays. Recycling was a problem in Gulfport, so although there is not a law requiring the City of Gulfport to recycle, they offer a curbside program where they provide the recycling bins free of charge as long as the person has a garbage service to the city. Large items can be picked up on the curb, and a recycling truck will come by and pick up the items. This is community-based. Mosquitoes have been found to be a problem in Gulfport. According to the American Journal of Public Health, the use of IVM, integrated vector management, can decrease the problems associated with difficulty controlling disease outbreaks. A mosquito control program has been put into place in which mosquito control technicians are treating known breeding areas by ground and by air, as well as by responding to calls from citizens. Appointments are needed in order to meet with the City Council members, but when called, it was not hard to book an appointment. The City Council members will serve for 2 years, and the Mayor will serve for 3. There is no information regarding the amount of people that attend the meetings, but all meetings are listed online and times and locations as well. If one is unable to attend meetings, there are online meetings that are posted that can be watched in full. The local government channel is on channel 640 on local cable. There are no public concerns at this time. There are education programs in place for areas that lack. the budget is to go into appropriate places. Community health problems are listed in order of priority. Sexually transmitted diseases are the leading cause of communicable disease in Gulfport. This was chosen as the first one because there is a large amount of sexually transmitted diseases, and in the community, if this is not addressed, it can continue to spread from person to person. Education on protection during sexual intercourse and abstinence is important. More than 63% of adults are obese or overweight. This was chosen to be second because this is a large percentage of people that are obese. From a nurse's perspective, this needs to be addressed because obesity leads to many other health issues, including heart disease, hypertension, and many more diseases. As a community health nurse, education on healthy eating and exercise could be implemented in order to improve this number. Heart disease is the second leading cause of death in Gulfport. 41,643 people are diagnosed with heart disease every year. Heart disease can be genetically associated, but it can also be due to other healthcare risks. With the obesity rate being so high, this could also be why the heart disease numbers are so high. From a community nurse perspective, this issue needs to be addressed in order to prevent further deaths. Programs are in place to promote healthy living as well as preventative care. The rate of unemployment in Gulfport is 10.5%. With unemployment comes multiple other issues. From a community nurse perspective, this needs to be addressed in order to help prevent lack of health care and health problems. Low-income families are more susceptible to sickness and less likely to get treated. 16.3% of Gulfport is in poverty. Although this is a huge problem, I felt like the other community problems came before this. 16.3 is not necessarily a significant number, but it is still a concern for the community. Community programs are in place in order to help those who are poverty-stricken. As a nurse in the community health field, as patients come in that are in this category, they could help refer them to agencies that can help. 22% of Gulfport only has some college education. This percentage is very low. With a percentage this low, this means that a large amount of the population most likely do not have well-paying jobs. This increases the risk of them not having insurance as well as not receiving health care and good nutrition. This is a concern for the community health nurse because the lack of education can lead to these problems.
One of the biggest global public health threats in our community as well as globally is poverty. In the city of Gulfport, 16.3% are poverty-stricken. In the state of Florida, 16.3% are also in poverty. The United States has defined poverty within a family of four as living under $24,000 a year. That is a family of four living on $65 a day. 14.5 people in the United States are in poverty. Globally, poverty is categorized as living on less than $1.25 per day. Countries that are experiencing less poverty are outsourcing their product production to other countries. This may help decrease the poverty level. Other organizations are branching out and providing clean water and food packages for poverty-stricken countries. America is trying to reduce poverty by giving government help to those in need. Unfortunately, it is often taken advantage of, and the people that really need it do not receive it.